I am State Health Officer Dr. Dean Seidlinger. I have an important announcement relating to the rule requiring indoor masking. Our most recent COVID-19 forecast shows that the number of sick people in the hospital will decline to a point where we can safely lift mask requirements in indoor public spaces by no later than March 31st. That we are making this announcement today is a testament to your collective efforts to stem the tide of the virus throughout the course of this pandemic. Thank you. Some people may ask, can't we lift mask rules now? Right now, it's not safe to lift the mask rules. Although newly diagnosed daily cases of COVID have declined dramatically in recent days, COVID-19 related hospitalizations remain near peak levels, exceeding 1,000 a day, and our hospitals remain under significant stress. Our hospitals are still relying on more than 1,200 National Guard members and more than 1,000 medical professionals that Oregon has had to bring in from other states to provide needed patient care during this latest surge. But it will be safer to lift mask rules by March 31st. Recent projections indicate that COVID-19 hospitalizations may be peaking. By the end of March, they are forecasted to drop to about 400 a day, approximately the levels we were experiencing prior to the Omicron surge. If we reach safer levels more quickly, we can consider lifting the mask rules before March 31st. Whenever that occurs, many people should strongly consider wearing a mask. People who are unvaccinated, elderly people in congregate settings, people who are immunocompromised, people at higher risk of contracting disease, or anyone else who lives with someone who is in those categories. The evidence from Oregon and around the country is clear. Masks save lives by slowing the spread of COVID-19. And the faithfulness Oregonians have shown in wearing masks, getting vaccinated, and following the other public health protocols over the course of the pandemic has saved lives here in Oregon. That is why our state has the third lowest cumulative COVID-19 case rate in the nation and the seventh lowest COVID-19 related death rate. That is why, according to the most recent modeling, COVID-19 hospitalizations will not even reach the peak of 1,178 daily hospitalizations we experienced during last fall's Delta surge. That is why our hospitals are no longer in danger of reaching the breaking point that early this year appeared to be a realistic possibility. We cannot drop our guard and risk a resurgence that could overwhelm our healthcare system. Our healthcare workers and resources have been severely strained for far too long. Many of us are still impacted, recovering from illness, taking care of a loved one, or anxious about what COVID will bring next. If we can maintain our vigilance over the next 2 months, we can all look forward to a spring and summer season in Oregon free of daily impacts from the pandemic. Thank you to all Oregonians who have helped us get to this point by getting vaccinated and boosted, wearing masks, staying home when you're sick, and taking other measures to reduce our risk when cases throughout the state are high.